had 11 deaths reported. Our total deaths in Boston is 919 from the beginning of COVID-19, and we continue to pray for the families who are struggling, people struggling with COVID-19, and the families that lost loved ones. We want to know that you're in our thoughts and prayers. Testing data for the week ending November 23rd, we had an average of 4,860 tests each day, compared to 4,200 the week before. So we've seen significant increase in testing in the last month here in the city, but in particular on 1 week, 660 new tests, which is good. This does not include college testing going on right now in the city. It does reflect the strong demand for testing ahead of the Thanksgiving holiday. So we're encouraged and thankful that everyone that got tested, and we want to urge everyone, even though you get tested before Thanksgiving, it's important for you to get tested after Thanksgiving as well. So we urge you, if you were in large gatherings or any place that you might have been in contact with public people that you didn't know, you should get tested. Currently, we have over 30 testing sites in the city. You can find them listed on, you can go to boston.gov/coronavirus, or you can call 311 to get testing locations in your neighborhood. We continue to expand our testing capacity, especially with the communities with the highest rate of infection. Our free mobile testing sites this week are we've been in East Boston for several weeks now, Central Square Park in East Boston, and then we're also in Washington Park Mall in Roxbury at the corner of Martin Luther King Boulevard and Warren Street. I'm also announcing a third mobile test site this week. It will be operating through Thursday in Jamaica Plain at Anna Cole Community Center in Jamaica Plain. It's open from 3 p.m. to 7 each day. To provide more access for people who are working and have a chance to go get tested after work. We continue to urge employers to be flexible and provide time for folks. So if people are asking, we're asking you to allow your employees go for an hour of the day to get testing if they want to get testing. Also a reminder, our mobile testing sites are free and open to anyone, regardless of whether you have COVID symptoms or not. So the 3 mobile sites, you can go, just set up an appointment and go get tested without any type of symptoms. The percentage and the positivity for the week ending November 23rd, the average number of positive tests each day for Boston residents was 183. That's down from 252 from the previous week. Our current community positive rate was 3.4%. That's down from 5.4% from the current week. No neighborhoods had a positivity rate over 8%. Dorchester, East Boston, Hyde Park were over 5%. Every neighborhood saw positivity rates go down in this last week's 7-day average, which is good to see. So in 2 weeks leading up to Thanksgiving, our numbers went in the right direction. We may see increases with the impact of the Thanksgiving holiday, and that's why it's important for us to get testing to see exactly if there has been any spread of the virus during Thanksgiving. You heard me report a large number of cases today, over 400 new cases. We're going to be monitoring the data closely as it comes in to make sure that we don't see these large spikes. That 400 number has been the largest, honestly, I think since June. We haven't had a day that big, so we're going to, tomorrow and the next couple of days, see what the numbers look like. In the meantime, we have to continue to do everything we can to stop spreading the virus. We're going to keep providing testing resources along with health and safety guidelines, and we'll also need everyone to take your personal precautions as serious as ever as we move into this holiday season. We're asking people to cover their mouth when they cough, wear a mask or face coverings when you're in a public space or when you're walking. That's an order by the state. Wash your hands with soap and warm water frequently. We're asking people to use hand sanitizer, but the best way obviously is soap and warm water as often as possible. Clean and disinfect your surroundings, touched areas that are often touched areas, door handles, doorknobs, car doorknobs, door handles. If you go shopping, quite honestly, if you can wear gloves, wear gloves. So when you're pushing the shopping carriage, I know some supermarkets have a little cloth to clean it, but just to give yourself as most precautions as possible. We're also asking you to take precautions in the workplace. Don't assume it's your home. Even though it feels like an extension of your home, we're asking you to be very careful there because you don't know when people coming in at night cleaning and other people where they've been, so we want you to make sure you take all of that very seriously. If you are an employer, we're asking you to make sure that your workers have what they need to be safe. Allow people to work from home if possible, something that we'd like to see happen certainly for the next few weeks here in the city as we're seeing these numbers fluctuate a little higher than we'd like to see them. If you have a reason to think you've been exposed to COVID-19, we're asking you to get tested right away. and self-quarantine. And that's I know the rules are changing on self-quarantine. Some people are saying 10, some people are saying 12. I would suggest you self-quarantine for 14 days if you think you were exposed to somebody with the coronavirus.